Hi Sanct, I'm Dr. Ali. I am a women's health focused chiropractor and I am here to restore your core and pelvic floor. I have a huge focus in postpartum and perimenopausal problems that affect women that we're often told, oh, it's just a side effect of being a mom, or it's just a side effect of getting older. But the fact is that there's a lot that we can do to improve, to fix, and to prevent these common things that women experience, like incontinence, like pelvic floor pain, pain with sex, pressure deep within the pelvis, low back pain, or a stubborn midsection that just doesn't seem to respond to regular exercise or nutrition. So in this series, I'm going to walk you through the foundation and building upon that foundation in order to, like I said, improve, prevent, and fix a lot of these common core and pelvic floor disorders. I always like to say we start slow now so that we can go fast later. So I want you to get into the mindset of really connecting to your body, getting out of your head and into your body throughout the series. This first session today, we're going to be focusing on breath work, and I'm going to introduce you to proper TBA and pelvic floor engagement through a variety of exercises. There's 4 pillars to my protocol. It's breath work, posture protocol, core and pelvic floor, and glutes. And I find by really focusing in on those 4 pillars that we get incredible results. So let's get started. The first thing that we're going to do is start in either this kneeling position, or if it's not good for your knees, go ahead and lie down on your back. Take a moment to really sink into your body, bringing your left hand to chest and your right hand to belly. And I just want to mention that as I'm filming this series, I am actually 3 months postpartum myself. So this is a lot of things that I've been doing to heal my own body postpartum. She's just napping right now, so we might hear her in a few minutes, but luckily my husband will be able to get her and feed her. So what we'll do here, left hand to chest, right hand just underneath your belly button. We're going to start by taking really deep inhales in, feeling the belly rise and ribs expand as you breathe in, and then letting it all go. Full breath in, not forcing it, but really noticing the air that fills the lungs, causing the belly to expand 360 degrees as you breathe in and exhaling fully. We're staying here for another 5 full breaths. And I want you to imagine that as you breathe in, your diaphragm pushes down as it accepts that new fresh air, and it presses down on top of your pelvic organs. So that's your bladder, your uterus, and your rectum. To accommodate that increase in intra-abdominal pressure as you breathe in, your pelvic floor actually needs to lengthen slightly. So thinking about that on this next breath, as you breathe in, the diaphragm presses down, pelvic organs press down as well, and the pelvic floor actually has to lengthen a little bit. And then as you exhale, that pelvic floor reflectively contracts and everything goes back up. 2 more breaths here. Belly rises, ribs expand, full 360-degree breath. Exhale, letting it go. Last time here. Breathing in, belly rises, ribs expand, diaphragm presses down on top of those pelvic organs. Pelvic floor has to lengthen, and then reflexively contracts as you exhale. Now, important to understand that if you have poor breathing mechanics, if you have any restrictions, like say a C-section scar or a scar from other surgeries, if you had any trauma when you gave birth in the sense of major tearing or other issues, that might not feel super comfortable right now. And that's okay. That's why we're going to repeat and build on that breath work throughout. But it's essential to understand that relationship, that synergy between the diaphragm and the pelvic floor is key to core and pelvic floor function. So we're going to repeat that throughout this entire session. Now, the next piece to the breath work is actually starting to tap into proper engagement of the abs, or the transverse abdominis, and that is the deepest layer of your core. So we think about our 6-pack muscle. This is actually a muscle deep that runs horizontal. Think of it like your internal corset. So starting once again with the breath, again, kneeling or on your back, breathing in, belly rises, ribs expands, and as you exhale, start to think about narrowing at the waist or pulling the belly button in and up. Careful not to squeeze too high or suck in. It's just a gentle contraction and connection. Breathing in, belly rises. As you exhale, think as though we're doing up that corset. 360 degrees, everything starts to engage and come inwards. 3 more, just like this. Belly rises, ribs expand, thinking about narrowing at the waist or belly button in and up. Giving you another view here. Belly rises, ribs expand as you breathe in. Exhale, belly button in and up. Final time, breathing in. Exhale, connecting to the deep core, narrowing at the waist, belly button in and up. You should feel that gentle engagement here. If you look at me in the video, you'll see this would be me at rest. This would be me sucking in. And this is me here with that gentle connection and contraction. So good. Bring your body on down onto your back. Let it all go here. Coming on down. Bring the hands on top of your hips and just start to create space between your low back and the floor by tipping your pelvis away and then scooping the pelvis up and in and flattening the low back. So we pelvic tilt away and back in. Good, really focusing here not to do any too much movement through the shoulders. We're really working on that dissociation of the pelvis from the rest of the body. We'll do one more here. And then pulling that pubic bone up, not firming or pressing with an overbearing way into the ground, but you do want to close that gap gently and feel the pubic bone pressing up towards your knees. In this position here, we're bringing our legs up to tabletop, hands come up to the ceiling. In this position, we're once again going to tap back into our breath work. So breathing in, belly rises, ribs expand. Exhale, pull the belly button in and up, narrowing at the waist. What you want to feel for in this motion here, and truly take your hand and feel it on your belly, is as you exhale and engage that core, you want to make sure there's no doming or puffing through the midline of the belly. That's indicative of poor intra-abdominal pressure management, or diastasis recti, and that's the gap between the mid portion of your rectus abdominis muscles. Staying here and breathing, belly rises, ribs expand, exhale, belly button in and up, being able to hold that engagement while still talking, while still breathing. This is the work, this is the rep. The arms and the legs are just extra. Noticing that the low back is starting to lift. One more here, big breath in. Exhale, wrapping that core in and up. Hold that tension. Bring one hand onto the belly and then drop the other leg down. Notice the bend in my knee never leaves. We're just dropping it as low as you can maintain that connection. Bring it back up. We're going to do that same side. Breathing in. Exhale, wrap the core in and up. Drop that leg down, making sure there's no puffing, coning, or doming through the abs. Good, bringing it back up. For some of us, and really where I started with this when I gave birth just a few months ago, we might only be moving a couple of inches. Again, the rep is the breath and the TVA contraction. We're just challenging that engagement by moving the leg. Let's switch sides here. Breath in. Exhale, wrapping that core in like we're bringing the hips narrowed inwards and dropping that other leg down as far, only as far as you can maintain engagement. Every rep starts with a breath. Exhale, wrap, drop. Ooh, starting to get a shake. This is definitely my weaker side. My baby likes to hang out on this right side. Good. It's amazing to see how something so simple looking can be such a challenge when you're really connected. Yeah, there's that shake. Good, hug your knees into your chest, give yourself a little rock side to side, and drop the legs down and then press over onto your hands and knees. So moving into a little bit of posture here, we're gonna round the upper back, tuck
the tailbone under, chin comes to chest, and then puff that chest down, eyes to the ceiling. Alignment is so important as we rehab the core and pelvic floor. Things like rib flare, where the ribs are not stacked over the pelvis, or a big lumbar lordosis. It really affects how your body manages pressure. And pressure happens, like we talked about, from breath, but pressure through the body also happens when we sneeze or cough, when we jump and run, and really as we load the body throughout regular tasks of everyday life. So we want to get to a point where how our body exists day to day, not just when we're exercising and tuned in, is in proper alignment so that we can prevent, fix, and improve a lot of those common issues that you and I might have. Bring the right hand to the back of your head, rotate, elbow down, rotate up as far as you can. Let's do 5 on the one side. 2 more. If you feel like there's a little sticky spot, I have one just on that inside of my shoulder blade. Take a moment, pause here, and try to take a deep breath in. Send that breath to that area to expand, and then bring it back down. Reset the body, make sure that we're not in this sway back. Pull the pubic bone up and in, and then rotate down and up. We've got 5, 4, 3, 2, and 1. Staying in this quadruped position. If wrists are a pain for you, you can always come on down onto your forearms. And in this position here, once again, we're tapping into our breath. What's different about this position is we're gonna have gravity pulling everything down. A lot of my patients actually say they find it easier when they're first learning how to properly breathe and connect to the TVA and pelvic floor to do it in this position. So let me know what works better for you. So breathe in, let that belly drop. You should see it, you should feel it. Ribs expand and start to connect to that pelvic floor. I like to say a flower blooms through your pelvic floor. That's that lengthening that has to happen as you breathe in. As you exhale, pulling belly button in and up or narrowing at the waist. Pay careful attention that the initiation is through the lower core here and not the upper abs. Breathing in, belly drops down, ribs expand. Exhale, initiating at the belly button, almost like you're zipping up a sweater. Holding that gentle engagement. 3 more here, breath in. Exhale, rep. Remember, this is strengthening your core, just like this. Just learning how to properly breathe in all sorts of different positions is what's going to be the ticket to make all those other exercises that you do that much more effective. We never want to skip this step here. We don't just want to numbly move through our exercises. We really want to be engaged fully in everything that we do. Last one here, pulling it in and up. Low back is nice and flat. I want you to firm into both palms, spread the fingertips, and then just lift your right leg while maintaining that engagement. Again, we're looking to see, do you lose engagement? Do you cone? Do you don't? Do you really shift away? Keeping that proper alignment. And if you have it still, you're just gonna bring that leg slightly back. How still, stiff, and stable can you keep your body? Staying on that side, bringing it back down. Every rep initiates with a breath. Exhale, wrap it up and in. Lift, extend. Good, 3 more on this side. Breath, exhale, wrap that inner core, 360. Belly button in and up. 2 more, breath. Exhale, wrap. Lift knee, extend back. So good. If you're really nailing this on this last one, you can also add in the opposite hand. Bring that back in. Other side now, belly breath in. Exhale, wrap. Lift opposite knee, extend it back. Adding in that opposite arm only if you're nailing all the components of this exercise, which is the wrap, which is the stiffness and the stable body position as that leg lifts. If you're losing lumbar strength, that is, you lose that or you gain an arch in your back, I want you to go right back to just moving through the leg. Your TVA muscle, once again, it's like a corset. So it has a lot to do with the stability and strength of your low back. Oftentimes back pain can be improved, there, that was your last one, can be improved by properly tapping into that muscle, your transverse abdominis. All right, so we've introduced the dead bug there, we've introduced the bird dog. You are gonna see that throughout the series, and we're gonna build on that to make it more and more challenging. Don't forget, the rep is the core activation. Now, the last part of today's introduction to the pelvic floor and core rehabilitation is our glutes. And here's what you need to know. Listen, ladies, I'll be out at the grocery store and I can tell pelvic floor dysfunction. I'm checking you out from a mile away. Oftentimes the bum will kick on in an improper compensatory pattern to do the work of the pelvic floor if the pelvic floor is experiencing dysfunction. So what I need from you in this last part of our first class today is to really notice if you're somebody that uses your upper glutes to do a lot of this work, or if you can do it in a more proper way, which is using the lower third of your bum muscles to do the exercise. And I'll explain why throughout. So coming on to your back. Now, if you have a Coregeous ball, I'll invite you to get that now, or a couch cushion will do as well, but you also can do this without any extra equipment, no problem. Coming down onto your back, take that ball and bring it in between your knees, squeezing it with about 20% tension. Pull that pubic bone up so you flatten the low back. There is a difference in how the glutes manage the load of this glute bridge exercise when you're in this position versus where I want you to be, which is flattening out that low back. Here, bring your fingertips inwards on your belly and just think about a gentle narrowing at the waist to connect to that deep core. You want to keep that turned on throughout this exercise. From here, connect down to the bum muscles. You're gonna press down into your heels and lift with the lower third of your bum, keeping that squeeze in. We come down with control. The low back or the tailbone should touch before the glutes, and then we lift up again. We've got 12 total here. So what can happen, and I see this often in my patients who have had a C-section, is that because of the scar tissue that's forming in the core, because of pelvic floor dysfunction, whatever it might be, there's a couple different reasons why it can happen, but the lower third of our bum starts to compensate and become part of the pelvic floor, so to speak. So it has to be turned on all the time for inner core unit stability. We don't really want that because we want these muscles to be our powerful muscles. Think like pushing a sled in the gym. And when that happens, when they're turned on all the time to support the pelvic floor, this is our last one here, bring it all the way up, hold for a beat, and come back down. When those muscles are turned on all the time, what starts to happen is the upper part of your bum starts to become overdeveloped. A good strong set of glutes should be like an upside down shaped heart, but when there's pelvic floor dysfunction, this overdevelopment of the top part of the glutes makes it look like a heart shape. We call it heart bottom syndrome, which is why it's so important for the pelvic floor to build strong booty. From here, coming onto your hands and knees, pull that pubic bone up and in, belly button comes up and in as well, firming down through the hands. Right leg's gonna lift. I want you to point your toe. We've got 12 glute kickbacks. Once again, how stiff, strong, and stable can you keep your core? If the wrists are a problem here, you can come on down onto your forearm and think about intentionally squeezing the lower third of your booty as you lift. We've got 3 more. For 3, 2, and 1. Coming down on your left arm, same leg is gonna move up and out to the side into hydrants. Good, leaning with that knee, lifting only as high as you can maintain control without pressing or dumping too much onto the opposite side. We've got 5, 4, 3, keep that core connection, 2, and 1, pressing back up. Once again, resetting, pubic bone comes up, belly button comes in and up, thinking about narrowing at the waist, or almost like a hollow scooped out core. Other leg starts to kick back, keeping that toe pointed and connecting, feeling the glute muscle moving. We're not just numbly moving through these exercises to check it off our list. We're feeling each and every rep to know that we're doing this right and getting the precise adaptation that we're looking for so that we can get the results that we're looking for. Sounds like a good deal. 3, 2, and 1. Touch that back down. Opposite arm comes down and we move that leg up and over to the side. Good. Stick with it. Connected here to your core, to your midline still. Feeling this exercise in the hydrant a little bit higher up in the bum. We've got 4, 3, 2, and 1. Coming on back down. So with women who have had C-sections, ball or couch cushion between the knees. We've got 12 here. Pubic bone comes up, low back flattens. So with women who have had C-sections, what can start to happen is because that was an incision through 7 layers of tissue, as that heals, your body lays down scar tissue as fast as possible so that your wound heals, and that's important. But what happens with the scar tissue is you start to lose proper slide and glide, and often that becomes an area of the body that you become largely disconnected to, not just because of the surgery, but because of how the body has healed. If you're not intentionally doing scar tissue massage or going to see somebody with it, then what starts to happen is, we call it like a mom pooch or a little bit of a shelf. And it's not necessarily, let's move over onto your hands and knees here. It's not necessarily adipose tissue or excess fat. It's because of the scar tissue that's building up between your skin all the way to your uterus. It creates almost a shelf that anything above it sits on. So by partaking in this series, you're going to learn a lot of different strategies for how to improve that, including scar tissue massage, which we'll touch on in our next class. Let's go for 3, 2, and 1. Bring that opposite arm down, up and over to the side. But also by strengthening your glutes appropriately, learning proper breath work and alignment, you'll start to notice that that area, just by nature of all of those things, starts to look and feel a little bit different. We've got 3, 2, and 1. Press it back up, reset the body, belly button in and up, other side, keep that toe pointed in these exercises. So once again, heart bottom syndrome is something that can develop for anybody that is experiencing poor management of their intra-abdominal pressure. But in my practice, I see it most commonly in women who have had C-sections, that their body over time has developed this compensatory pattern where their lower abs become distended, their bum starts to tuck under, and the upper part of their glutes starts to become overdeveloped. Their bum looks more like a heart instead of an upside down shaped heart, which is what we want. Last one here, bring the opposite arm down, bring that leg up and out to the side. Good. So by fixing compensatory patterns, by strengthening weak areas, by stretching out tight areas, that's how we start to see a full body change in so many of these common conditions that women have been told, hey, you're a mom now, it's what you signed up for. Newsflash, Jen told me this several years ago. Let's go 2 more. But newsflash, when you became a mom or just because you're a woman, you did not sign away your rights to feeling good in your body. This is how we make real change. Thank you for spending this first session with me. This is the foundation. I would encourage you actually to go back to the beginning or to work on that breath work a significant amount. I like to say every red light you're at, every stop sign, you're doing a breath. Full inhale, belly rises, ribs expand, and then narrowing at the waist, thinking like zipping up the deep core so you feel that core engagement down nice and low before you move on to the next session. That is the meat and potatoes of fixing, preventing, and improving pelvic floor and core dysfunction.